My name is Dr. Debbie Harvey, and I am the CRUK GP at Cheshire and Merseyside Cancer Alliance. The following presentation is looking at the cancer elements of QOF for 2021, and it reflects the revisions published in September. It's important to note that there is significant overlap with the PCN DARES, and only the community of practice element of the DARES is not included in QOF in any form. We've created a two-page summary of the DARES and QOF, which will enable you to see where there is crossover and hopefully save you from duplicating any work and effort. So looking at the summary for QOF itself, there are really no changes. There is still a requirement of practices to hold a register for those with a cancer diagnosis. There is still a requirement for cancer care reviews, and cervical screening remains unchanged, but the points have doubled. With regards to the QI requirements, essentially practices and PCNs need to show evidence of continuous QI and a minimum of 2 peer review meetings. There are some key points about QOF. There's a focus on restoration of delivery of screening, and the focus is on cervical screening, and ensuring patients who require urgent referral are identified, supported, and managed in line with NICE guidelines. And these key points are a reflection of some of the issues which have fallen out of COVID. With regards to what practices are required to submit, there is an A4 template, and on the right-hand side, we've listed some activities that you need to consider. So in order to complete the template, the practice will have required to have done an audit. You will require an action plan around engagement with patients about safe access. You'll need an action plan around cervical screening restoration. You need to look at safety netting. You need to look at your DNA numbers and have a system for follow-up. The practice will need to start to look at incorporating systems for early diagnosis, and this will probably result in part from the audit that you've done, engaging in new cancer pathways, and potentially in the future looking at SEAs for all diagnoses so that there's some learning and some change in practice if required. And the final point on the template is, how did others influence the practice's QI plans? So looking at the first element about restoring cervical screening. So this is what QOF highlights. It says, ensure appointments are offered to eligible women, actively identify women who've had screening delayed or cancelled due to COVID and ensure that they're appointed. And if there has been any innovation during COVID, that this should continue. So this ticks the box for cancer screening in the DARES as well, although obviously the focus is on cervical and not on the other two elements of cancer screening, which include bowel and breast. So some suggestions with regards to how you might tackle this area. One would be to check your numbers on EMIS and look at the trend in uptake and see what direction that's going in. There's a really useful cervical screening interactive resource. The link is on this page. There's also the PCN Cheshire Merseyside Cancer Alliance dashboard, which the CRUK facilitators can help you with. There are also Public Health England produced resources. The other point is ensuring that appointments are facilitated. Think about budding up with a neighbour practice, extended hours perhaps. And there are potential projects with public health online at the moment, which you may want to engage with. So just looking at a screenshot here of the cervical screening interactive resource. This is available online. It's very easy to use and may give you some indication as to how you are doing compared to your colleagues. The next point of QOF is looking at building confidence in primary care. So we know that there are some issues with patients seeking advice and support in primary care to varying degrees. So the aim of this action is to ensure that all patients receive a consistent message that general practice is open and is there to support them. I've highlighted in yellow here that there is an option to implement this at PCN level, working with local people, community and faith-based organisations and networks to better understand how best to engage. They also suggest proactively engaging with patients, families and carers and offering reassurance that general practice and indeed other healthcare settings, including screening, can be accessed safely. Practices are also encouraged to look at inequalities and focus on groups where there may be barriers to accessing services, particularly where there's a disproportionate drop in activity. And there are suggestions with regards to this, looking at text or letter and a variety of inclusive formats. And you may want to work with local partners to include targeted and culturally competent messages. So this specific bit of QOF is not in the DES, it's additional to. So some suggestions with regards to this element, as has already been mentioned, you could look at text messages, website messages, local comms, highlight positive patient experience by perhaps having a video and putting that online, checking for any groups where there might be inequalities, whether that be language or ethnic minorities, etc. Joining up more broadly with neighbouring practices and PCNs for a very unified approach. And there are some other ideas more broadly from the Help Us, Help You NHS campaign. The next element of QOF is to monitor suspected cancer referral rates. So this is looking potentially at improvements in the quality of referrals, ensuring that they align with guidance. So that's NG12 in this particular instance. And to assess if referrals are returning to pre-COVID levels. And practices are encouraged to reflect and identify their awareness of referral and testing pathways, including the impact of any pathway changes which may have happened during COVID. So there is quite a bit of crossover here with the DES, apart from the COVID-specific restoration aspect. So some suggestions regarding this particular area. So we'd suggest that with the referral rates that you need to look at your referrals before, during and after the pandemic, indeed during again, as we are now in the second phase, and look at that trajectory and look at specific tumour pathways. So we know that in some areas, lung referrals have dipped, so you may need a bit of focused work. There's a really helpful ERS dashboard. It does look at CCG level data rather than at PCN data, but that might help gauge overall patterns. Other areas with regards to referrals are described in some detail in the DES PowerPoint presentation. So this is basically one of the graphs that you'll see if you look at the ERS dashboard. So this is the dashboard looking at the 2-week wait referrals for Cheshire and Merseyside as a whole. And you can see the massive dip during that first wave of the pandemic. So it'd be useful to look at what's happening locally because there is some variation. The next aspect is safety netting. So this specifically says that practices should have a robust and consistent system in place for safety netting, supported by high quality, appropriate and responsive communication and patient information when patients have been referred on a 2-week wait referral, making sure that you follow up those who do not attend any appointments. If they've been referred and they haven't been referred due to the level of risk and or patient concern, or they've been referred on an urgent referral pathway but have been downgraded, of course with the consent of the primary care professional. So this includes practices understanding of the status of patients who've been safety netted during the pandemic and if further action may be required. So safety netting definitely ticks the DES box as well, and as a result of that is very much covered in the DES PowerPoint presentation. So this final slide is one that we showed just earlier in the presentation and is just to show you what you need to do to tick the box, if you like, for the QOF QI. But as we mentioned before, there's a lot of overlap with the PCN DES for early diagnosis of cancer. So I would recommend you now watch the next presentation about the DES so that you know where there's overlap, and that will save you a lot of effort and duplication.